Now, we've got our little clinic, haven't we, about all the weird and wonderful questions you get asked, but I just want to touch on Mama Khan. Your lovely mum, who you have been sharing with us, has been poorly, but you've got some good news.
Yeah, for those of you who don't know, Mama Khan has an inoperable brain tumour. She's had it for a number of months now, and it was pressing on one of her nerves, affecting her vision and her eyelid. So she had 5 weeks of radiotherapy a few months ago, and then we waited for a scan, and we got the scan results on Monday, and it's really good news. The tumour has shrunk by 2 millimeters, which is great. It gives us more time, and it helps preserve her vision. So we're really relieved by that.
Yeah, well, we're really happy for her and for you too, because I know how worried. Even as a doctor, you're just a son, aren't you? You know, you're worried for your mum. So yeah, so we're really happy for her here too, and for the whole family. Right, should we pick up on some of these questions actually? Now, they are a bit weird, I'm not going to lie, but that's the point. You're saying don't say that, Ranveer. Nothing's too weird for your GP.
Nothing's too weird. I'm so excited about this, Ranveer. These are the questions that people want to ask me and never get a chance to. So let's go through them.
Okay, I've got a first one. I've got the first one for you. Starting with a smelly belly button. What's going on if that's happened?
Really common, really common. So our belly, really common. Our belly buttons are kind of warm skin folds where they can collect soap, oil, dead skin, bacteria, fungi. All of those bacteria and fungi feast on that collection of material. It's like a bounty for them. And as they're breaking it down, they release sulfur, which gives a characteristic pungent smell. If you've ever put your finger in your belly button and sniffed it and it smells, you have got bacteria and fungi in there. It happens, Ranveer, it happens. So the best thing to do is give it a good wash, but make sure you dry it afterwards. So either with a towel, a tissue, or even a hairdryer. If you've got an innie belly button, you can use a cotton bud, but very gently, don't push too hard. But if you've got discharge bleeding or even a stone in there, which is all that collection hardening up, come and see us as GPs and we will sort it out for you.
Okay. Spots on your bum?
Again, very common. Nobody talks about it. It's not acne when you've got spots on your bum or back of your legs. It's not a type of acne. It's something called folliculitis. It's inflammation of the hair follicles around there, and it can give you raised kind of lumpy areas, which can be embarrassing if you're wearing swimsuits and that kind of thing. The best thing to do is make sure you have a good wash after you've exercised, because sweat can collect there as well. It's caused by friction on the clothes as well. So make sure you wear loose-fitting clothing. And also, you can buy something called glycolic acid wipes, just online, less than a tenner. You get a tub of wipes, and if you wipe that area of skin every time after you have a shower or a wash or after you've exercised, it can help. And you can also buy some benzyl peroxide wash, which you can use 3 or 4 times a week, and that will help. But if you get any kind of pus coming out of them, if they're very painful, if they're recurrent, come and see us, and it might be something else, but nothing to be embarrassed about.
Wow, brilliant there, actually. Now, we heard Jessie J earlier talking in the podcast about the fact that for about 5 months she had pins and needles and sort of didn't do anything about it. And then, of course, she got diagnosed with breast cancer. Is there any link? It's not something that I've heard of before, but pins and needles in your hands and feet, what does that mean?
So pins and needles in your arm, which Jessie J described as one of her symptoms, is a very unusual symptom of breast cancer. It usually means the tumour or the swelling around the tumour is so big it's pressing on the nerve and giving you that dead arm. What I would say is any persistent, unexplained symptoms of any sort, you must come and see your GP about. But pins and needles in your hand at night is fairly common. It's usually a pressing of the nerve, something called carpal tunnel syndrome, where the median nerve is the most common. It's the nerve that comes and gives to your thumb, your index finger, and these 2 fingers here. And it gets pressed on when you're asleep. It's really common if you've got diabetes, thyroid disease, or if you're pregnant. And often you end up waking up in the middle of the night and shaking it out like this. Now, what you can do about that is just go into the local chemist and you can buy a splint for your wrist, and it'll keep it in position overnight so your nerve doesn't get pressed. If it's happening a lot and if it's happening through the day and it's affecting your grip, that means it's progressing. And come and see us. We might need to do some blood tests to check your thyroid, to check your blood sugars, or we may need to refer you onwards to have the carpal tunnel itself release the bit that's pressing on the nerve.
Oh, brilliant. Right, OK. So one of the other strange questions is why do your ears pop when you yawn?
Yeah, this happens to all of us. Now, we've got a tube that connects our middle ear to our throat called the eustachian tube, and it's a fluid balance system. It corrects the balance if there's any issues there. Now, if fluid collects in there, particularly if you've got a cold, if you've got allergies like hay fever, it can take time to upset the balance. But when you yawn actually that tube opens up very briefly and the balance system has to correct really quickly. And that's that popping or crackling noise you can hear. It's completely harmless, but if it's happening a lot because of those things I mentioned, like allergies, take regular antihistamines. But if you've got a headache or dizziness with any of that popping or crackling, you must come and see us because that could be something more serious.
Oh, really? That's really interesting, actually. Now, what do you do if you have smelly feet, even after washing them? So you were still washing them, you think, why don't they smell clean?
Yeah. Now, believe it or not, Rambia, our feet have more sweat glands per square inch than any other part of our body. Now, sweat itself doesn't smell, but if you're wearing shoes and socks where bacteria have collected because it's a nice, warm, dark environment, they will then feast on that sweat and again release those sulfur compounds as they break down sweat. That is that smell. Now, you can wash and wash and wash, but if your shoes and socks still contain those bacteria and fungi, you will continue to get smelly feet. So again, wash, make sure you completely dry afterwards before you put your shoes and socks on, but buy some antibacterial or antifungal spray your shoes and socks before you put them on, and over the next week or two, your feet will freshen up.
Oh, brilliant advice. And a final one, why does your nose run when you're eating spicy foods?
Yeah. Now, when you're eating spicy food, they release compounds such as capsaicin, which irritates the nerves in your nose. And they then send messages to your nasal glands to start releasing fluid and mucus because they think they need to wash out an irritant that's gone up into your nose. They don't realize it's something you've eaten. It's harmless. It's nothing to worry about. I would say continue eating spicy food because you deserve a bit of spice in your life.
You certainly do. Thank you so much, Amir.
Thank you.
Just packed with loads of really curious information that does. It's a weird question you ask yourself, but you think, well, I'll never ask my doctor. I don't want to waste his time, but fantastic. Yeah. Thank you so much.
Looking for more health and wellness content? There's plenty more right here on our channel. How about you check out this one?